Thank you. So, as I have put up on the screen, there are some elements of conventional dentistry that I have put on 3 lines. Mercury is the third most poisonous substance after uranium and plutonium. Fluoride is almost as poisonous as arsenic. And finally, root canal toxins is a dead cellular protein and just as poisonous as mustard gas. So realizing that over the years as a dentist, I passed my examination in '75 and has been in clinical dentistry ever since, just with a few years of interruption where after being presented on a big conference in US for the realization of what kind of life a normal dentist lives in terms of mercury vapor and being handicapped on many levels, working with mercury vapor, I made a choice to leave dentistry for a while and then came back 2.5 years later. But being a dentist, normally trained, I felt after traveling to US that I had to leave dogma. I had to open up for meeting pioneers in other countries and being open and learn from elder colleagues who had went before me and taught me about the dangers of mercury, fluoride, and toxic substances from dead or root canal field teeth. So in that sense, you could say that this entity plays quite a huge role in dentistry. Mercury filling being around since 1818, introduced in Paris that year. A couple of years later in England, the Smith brothers took the new wonder alloy mercury fillings to US, New York City. I believe it was in 1824. And in that introduction, the old dentist or the old school dentistry in US came to a clash with the modern dentistry. They used plated gold to heat it up and put it into the cavities, or they used different kinds of cement or extraction. That was the framework of dentistry at that time. Now they had the introduction of a totally new chemical. Over the years, things changed in my professional life, and I haven't put in an amalgam filling since 1985. After being a dentist, I went on to study at the university different social matters, science, political matters, to have more instruments in my box, so to say, so I could travel in US and other countries and meet the pioneers and read their books, make some interviews for lectures and other things. And today, when I see my clients for the first time, this is like a 90, this is this is from the 90s, slides and transparencies. It's not PowerPoint, but I hope you can bear over with me with the changeover of pictures. So new clients are much more than a set of teeth, regardless the position of the teeth. But as I have developed my way of practicing over the years, I see it as a window to the whole person. And I give the clients a questionnaire that will reveal different aspects of their life, their symptoms. So that will be the basis for a talk, an exchange of a communication on different values already the first time. So I've tried to see and invite honest communication on healthy lifestyle and problems between me and the client. And sometimes the client will arrive. This is quite healthy teeth. You can see harmonic positioned teeth, the gum is looking very nice, could reflect a healthy lifestyle and a sound, stress-free personality, could be. And the same person could also look like this 2 months later, having gone through a lot of stress. As you can see, swollen gum and high risk of blood coming from the gum, from the gingiva when you use your floss or sticks. And this can also reflect problems. I will come back to that in a chart later. But as you see, the front teeth relate to bladder and kidney. And often the bladder meridian will be the acute stress meridian, indicating that the person is stressed from his or her job or private life. And if that stress isn't healed, acknowledged, the gum can look like that. And if you can have a supplement in your advisor role to your clients, which is going beyond use your sticks a bit more or brush a little more efficiently, then they have a chance to realize that this is just a window situation. They have to look into their life situation to make this change to strong, sound gingiva. And sometimes when I open up like that, you can see in people's eyes, well, I'm being respected here for who I am. I'm not just a set of teeth and a victim of my dentist's possible choices, picking down from the shelves whatever material he or she as a dentist would prefer in my mouth. Here I can negotiate the material choices that I will experience along the way. The chart that they will see, I think I will learn this in a couple of hours. So walking around. So these symptoms coming from Colorado Springs of mercury poisoning symptoms, classical mercury poisoning symptoms, you just have your eyes run down. These 30 symptoms is a fundament for my questionnaire. So when they sit in the waiting room before they enter the clinical room, they say if they have acute symptoms of that or chronic, had them before, and then I can pinpoint the degree of a possible mercury poisoning effect in that particular client. Nå, undskyld. Det var. Sådan der. Så går vi videre med nogle lysbilleder. This is rare view, I would say, but in my late 70s in central Copenhagen, some people went to me in that situation, and of course this is a lot of suffering here. Not only calculus, but look at the gums and what that reflects in that person's lifestyle is sad. It's really sad. So that is marginal, I would say. It's rare we see that. And that's what's happening because of the bacteria. And often, whatever it's an alcoholic or having a poor lifestyle in terms of bad nutrition, the colon and the small intestine is in chaos, you could say, and that reflects the tendency to develop periodontal disease. And you have early degrees on the left and more severe degrees on the right. And on the right side, you see bacterial, you see calculus, including anaerobic, meaning living out without oxygen, anaerobic bacteria living in the depth of deep pockets, creating the toxins that I mentioned to you before from dead or root canal teeth. So they have mustard gas in their deep pockets, like situation. And these toxins can travel to the gum, to the bone, and also through the microchannels along the root side to the nerve and create infection in the nerve pulp. So these years, a lot of people talk about having no root canals. But as one of the pioneers in this field mentioned, at the same time, they have to realize that the same toxins are being created in the depth of the pockets. So they have to look at the periodontal disease in the mouth, but at the lifestyle also. German doctors and dentists had for decades declared on conferences that if you have turmoil in the lower part, in your intestines, it will automatically reflect imbalance in the mouth, in the jawbone, in the ligaments, in the gum, creating periodontal disease. And it's not cured with better brushing or using your sticks or flossing. So you could say wearing a cross with a center in the mouth is just a symbol of what many German doctors and dentists have claimed over the years, that up to, or maybe more than 1/3, maybe even 2/3 of the root cause of chronic diseases we can find in the mouth, as amalgam fillings, root canal, deep pockets in periodontal disease, dental focuses, inflammational focuses under the teeth. Another thing called cavitations, which are infection or sterile, which can be an aftermath of extraction where you don't clean the bone. So the gum heals over, and you are left with what could be a cystis. But it's in English language it's called a cavitation, and you can see it on the X-ray picture as the overview. And that creates a interference field with the rest of the body, as well as a root canal or high-level current on an amalgam filling. So cavitations can actually be quite unnoticeable in normal dentistry, but have a huge impact in biological dentistry. And we have to clean out those areas of the jaw. So some of my clients, some of these are from Hal Huggins, one of the American pioneers among biological dentists. This could be a person suffering a lot, but she's not met by the different professions. They can't explain what's wrong with her. And finally, she knocks on my door or Hal Hugginson's door and said, I suffer from this and this. And you saw the chart before. And most therapists or doctors or cardiologists or even the priest or psychologists or psychiatrists can't explain. Maybe they start treating her, but it's off the point. So if they can find the bullseye, or you can identify a mercury poisoned person, then this person have opportunities. And you could say that this person, from an okayness, where there's a balance, if the immune system is represented by a glass of, say, medium height of stress in this person's lifestyle, someday, the day after a night out or whatever, you have a clinical system. I mean, if there's stress in that person's life, suddenly the next morning, a person can wake up with a headache or other severe pains, or because the jar is overloaded, and we have a clinical system. And that goes for mercury poisoning as well. What a lot of people nowadays look at as a possibility is to empty the glass and have a more easy walk on earth in terms of living on many levels,